Welcome back, everyone. Thank you for tuning into my channel, Case Managed, Concussed, and Post-Concussion Syndrome. Please feel free to subscribe and drop me a line. I'll be more than happy to hear any comments you may have or any questions that may come up. Today, we'll be talking about mild traumatic brain injury and the wellness zones. The mild traumatic brain injury and the wellness zones. The wellness zones are created to help our patients, family members, caregivers understand where symptoms may be pushed over the top and where we as patients can set those boundaries with others. A reason for this is a mild traumatic brain injury is the epitome of the walking wounded. Now, what does that mean? This means that many symptoms are not visible to the naked eye. You break a bone, it may go up in a cast or a sling. A hip fracture may require a joint replacement or repair, but a brain injury is sight unseen. Mild traumatic brain injury and the wellness zones. The wellness zones can help us recognize when we have a good or bad day. They provide us with a pathway and what can be done without pushing our symptoms over the edge. And, for those who have sustained a brain injury, you'll know that sometimes for some of us, we have feelings of guilt because we cannot do many of the things we could do before injury. And those things may have involved doing them with family and friends who may not understand that when one has a brain injury, we have what they call a depleted cognitive reserve. As I had mentioned on the previous slide about cognitive reserve, the brain uses more energy than any other organ in the body. Before the energy, we had a full pool of cognitive reserve. This cognitive reserve helps us when we overextend ourselves. After the injury, however, all our energy is utilized to even perform the most basic functions to get through the day, as pictured on the right. What happens is this requires more emotional and cognitive effort that consumes at least 25 to 50% of the reserve from what we previously had. So what do the wellness zones do? Well, the wellness zones help keep us in the here and now. The goal of following the wellness zones is to provide us with a self-assessment so we do not find ourselves drowning underwater with exacerbated symptoms such as pain and fatigue, which is the direct response from the lack of cognitive reserve the brain injured patient is left with. When we're looking at the wellness zones are broken into 3 different categories, very much like a stoplight. We have the green zone. As I say, this is very, very much like a self-assessment system checker that can at least give us some guidance on paper and map what we can do and what energy we have in order to pace ourselves through our day. So we start off with the green zone. The green zone is pretty much your symptoms are on the mild set. You're able to do tasks at home and work to the best of your capabilities, the maximum that your disability allows for, and that is as tolerated. You're also able to attend family and social activities, and this is definitely based through moderation or at your level of pace that is comfortable for you and your disability. So what does a green day look like? A good day look like? Well, a green day means we're utilizing the PACE method, as I had reiterated in the previous slide. And if you're interested in learning more about the PACE method, please feel free to check out my book. It's available on Amazon.com, either on print and ebook. It's called A Mild Traumatic Playbook for Patients, Caregivers, and Physicians. The PACE method is invaluable for us as brain injured to get through our tasks so we don't exacerbate our symptoms. So a good day means we are avoiding loud or enclosed spaces that could maybe sound off, ear ringing, make it really hard for us to concentrate. This may involve setting boundaries with family and friends in advance prior to attending a social function. And give yourself permission to take as many breaks and find a quiet place as needed. A good day or a green zone day is remember to take a 30-minute map during the day, especially if you plan to go to a social gathering that is late in the evening or afternoon. This will circumvent you from having additional setbacks later. A good day. A good day may also mean you're taking your medications, you're using your TENS unit, your transcutaneous electrical stimulation as prescribed by your doctor. You're getting exercise at least 30 to 45 minutes per day or as directed by your physician or physical therapist. A good day. What does a good day mean? A good day means that when we do go out, we have our survival bag. A survival bag is small little ice chest you can place in the trunk of your car with some water, cold and heat packs. Maybe you have a neck pillow, snow hat, or a baseball cap. You also want to make sure that you have your adapted devices. This may include any additional ear filters, hearing aids, or blue or orange tinted glasses that you may not be wearing on a regular basis, but may be using when you are going out into the community or outside of your house. Yellow zone. Yellow zone. This is when your symptoms are moderately intense. Moderately intense symptoms. What does that mean? It means it's taking more time than usual to track and follow social interaction, increasing hypersensitivity to light and sound, ear ringing, tinnitus that flares up much more than usual, all part of the yellow zone. Exercise caution. That's what this means. Yellow zone also means listening to when your body is talking to you. when your brain tells you it's time to sleep, when you're getting those cues, you know you're hitting the caution zone. When maybe your neck and shoulder muscles begin to tighten more than usual, or the head pain suddenly begins to start to worsen. All signs of caution. So what does the pain levels are on the numeric scale per se, maybe escalating, maybe outside of what our normal baseline is for those hours of the day. Finding that you're taking much more as needed pain medication is an indicator that you're in the caution zone. Another reminder is if you find you're at the breaking point where you're actually using a fake smile and that becomes a mask for how you're really feeling inside, you need to recognize you need to kind of exercise some caution and step back. All right, the red zone. The red zone is when our symptoms are severe and intense. The red zone may involve you're going to need a quiet environment. Feeling as if you would like to hide under a rabbit hole and need to sleep to recharge. You cannot find a balance between the pain and fatigue. Weighing that scale and not finding that balance is definitely a red zone. Keep in mind, I recognize this is all easier said in words than as it is to do in reality and in practice every day. Our brains weren't wired this way, but when they become rewired, we have to rewire how we think and how we process things, or else we're not going to get better. Red zone. Are you too exhausted to follow one-on-one interaction? If you find yourself slumping over in your chair in the middle of a social gathering, you're a goner. You're done. You could pay for this for 2 to 3 days after. Double vision may become more apparent. That could trigger a fatigue symptom right there. Movement and range of motion in the neck and shoulders is more restricted than usual. Very important to follow the physical signs of your body. I cannot emphasize that enough. Red zone. Red zone could definitely have you jumping off a cliff and having you try to find your way back up that cliff. The pain can be intensified to the point of preventing you from your work, household chores, and your social activities that you do as usual after your injury. After your injury, important to remember and recognize that. A sudden alteration of mood and behavior, you may find yourself becoming much short-tempered or much more irritable than usual. And, for resources, the wellness zones are found in my book that came out this year, Mild Traumatic Brain Injury Playbook for patients, caregivers, and physicians. So if you want more information, definitely feel free to dial up and look my book up on Amazon. I did reduce the prices as low as I can for what it took me to produce it because I really want to get the word out and help people. Please feel free to subscribe to my channel. If you have any comments, questions, please feel free to drop me a line. Thank you.